Welcome, good afternoon. Thanks for joining us, and to the online audience that's watching us, we welcome you as well. Errol Lewis, as was mentioned, I'm a journalist. I'm based in New York City with Spectrum News. And I am very pleased to bring you a panel. I'll reintroduce them as we speak. We don't have a lot of time, but the issues are so pressing and so important. What we're going to do is kind of give you an overview of some really important factors that are playing out in all of our communities all around the country. And this is an invitation, in fact, a challenge to journalists, to activists, to concerned citizens to join us in dealing with some of these very important issues. I'm going to start with Mayor Scott. Brandon Scott is the 53rd mayor of Baltimore, the youngest in that city's history. He took office during the pandemic in December 2020 and announced he would focus on the twin problems, the twin public health emergencies of COVID and gun violence. I am happy to report that as of July 1st, this is the lowest level of 6-month homicides in more than 50 years, and nearly 23% decrease compared with the first half of 2024. So, Mayor Scott, say a word about the public health approach, especially the use of violence interrupters, and how that brought about this record low homicide level.
No, thank you, and thank you for having me. We have to first understand that no matter who says something different, gun violence is a public health issue. And you cannot solve a public health issues without having a public health-based approach. So in Baltimore, we have a comprehensive violence prevention plan. We're now in year 5 of that plan. And that means that we're going to focus on every part of this public health issue. We do have an historic investment and invested $50 million into community violence intervention, where we pay people who used to shoot people to go and interrupt that violence themselves. We pay community organizations to respond to hospitals where people get shot. We pay community organizations like one that I'm a member of, We Are Us, to go out there and mediate these issues. But we also, through our group violence reduction strategy, go and focus on the individuals who are most likely to be the victim or perpetrator of gun violence and go to them. They get a letter from me, change your life. I'll help you get education, housing, whatever. But if you don't, then you'll hear from law enforcement. And that is how we've been able to do this. It's not just me as the mayor, it's the community, it's the city of Baltimore, it's everyone working in that ecosystem, from myself, my governor, the state's attorney, U.S. attorney, but most importantly, the community and those community-based organizations who believed in this public health approach.
I got a quick follow-up on that. The violence interrupters in New York and elsewhere, Boston, I know of, they make a point of not being, their credibility on the street depends on them not being seen as too close to the police department. How do you handle that?
Well, listen, you can't be, right? This way that I say to folks all the time, even some folks in the media, they would never ask me to unveil who a undercover police officer is because of their credibility and their credibility in the street. My violence intervention workers need that same accountability to their partners and their relationships. So we have to operate in that way. There are ways when things and brothers that can be able to check and get information to people that need to know, including me. But in order for them to have the credibility on the street to do what they do, and that's saving lives without guns, without bulletproof vests, without any of that, they have to be seen as a part of the community and not connected to law enforcement.
Okay. Dr. Roger Mitchell, he is the president-elect, by the way, of the National Medical Association. That's the Association of Black Doctors. He's taking office in just a couple of weeks. More importantly, he is the president of Howard University Hospital, and his medical specialty is forensic pathology. He previously served as chief medical examiner for the District of Columbia, and he's the co-author of the book Death in Custody: How America Ignores the Truth and What We Can Do About It. And so, Dr. Mitchell, you and I were talking before this panel. I really wanted you to maybe educate us about something called the Medicaid Inmate Exclusion Policy. This is a policy whereby it affects jails and prisons all around the country. The federal government excludes coverage of health care through Medicaid for prisoners and for people in jail who have not been convicted of anything, which on any given day might be more than 700,000 people. What are the health implications of that for local communities?
Well, thank you for me being here in the Global Black Economic Forum and all of you that are here listening and online. The whole concept of violence as a public health issue it really extends into public health issue, into everything. Health is in everything. And what we don't realize is that some of our sickest parts of our community go into our prison system, go into our jail system, whether it's mental health, whether it's diabetes, whether it's cardiovascular disease. These show up in our prison systems, in our jail systems, just as much, if not more, than anywhere else in the country. And so I often say that prisons and jails are just hospitals with security concerns. And until we realize that we need to be treating individuals like we treat people on the outside. So what is the Medicaid inmate exclusion policy? If you've been at this convention, you know that just a couple of days ago, Medicaid has been stripped from literally millions of individuals in this country. 11 million plus, $1 trillion taken away from Medicaid. But when originally Medicaid was established 60 years ago, actually it'll be June 30th is the anniversary, 60th year anniversary of Medicaid. It was, policy was established called the Medicaid Inmate Exclusion Policy. So that means that anybody that is in the jurisdiction incarcerated in jails or prisons do not have access to Medicaid. So their delivery of care is based upon that entity at that jail or prison providing that health care. So it's dependent upon if that private sector wants to provide good health care, then they can. If they don't, then they won't. One of the biggest things that Medicaid has brought to this country is the electronic medical record. How many of you can look on your phone, look at an app, and see your medical record, right? That is a function of the investment done by government in Medicaid. That you can't do if you're in jail or prison. In jail or prison, they still have the folders you take off the shelf with the little colored numbers on the side of the folders, and they have to look through your paper chart. Well, paper charts don't allow for you to get screened. It's not going to prompt to say, hey, that person is ready for a prostate screening exam or a colorectal exam or a hepatitis C exam. Those automated things aren't happening in our jails and prisons. So that means that individuals inside the jail or prison are coming to care later with a larger severity of disease. And maybe that's not important to you, but they come also with higher costs of care as well. So prevention, we know, works best for our country, but right now prevention of disease or injury is not happening behind bars.
And so then what happens next, of course, is that folks end up back in communities with a number of unaddressed health needs, right, which ends up not just being a health issue in the community, but also a criminal justice one.
That's right. We know that there's literature that talks about those individuals that are healthier and have access to health care are less likely to recidivate. Those individuals that are taking time to get their glucose checked, to get their yearly checkups, those individuals are less likely to commit crimes. We know this as fact. And so there is something that you can do. There is an amendment to the law that allows for individuals to get access to Medicaid 30 days before they're released. 30 days before they're released, they can get access to care. It's a reentry act. Right now, only a handful of states, 8 states, have that waiver, have that amendment. You can take that. Maryland is one of them. Massachusetts is one of them. And the list goes on. But you should find out in your state, do you have this waiver in place to allow individuals to gain access to Medicaid at least 30 days before they're released so that you can have continuity of care? And so when individuals come out of prison or jails, they're right into their primary care. They're right into their surgical needs so that we can decrease recidivism back into our jails or prisons.
Okay. Attorney Jarrett Adams is a nationally recognized civil rights advocate and the author of Redeeming Justice, From Defendant to Defender, My Fight for Equity on Both Sides of a Broken System. He was wrongfully convicted as a teenager, spent 10 years behind bars before being exonerated by the Innocence Project. He's gone on to become an attorney. And Attorney Jarrett, I want you to pick up on what we were just talking about, where there are deaths in police custody, an extreme version of the medical neglect that we just heard described. And we're at a turning point in both recognizing that and trying to find a cure for it. I know you're at the forefront of that. Tell us a little bit about that case.
Well, thank you for the introduction, and thank you all for having me here. Is my mic? I think it's on now. Thank you. Thank you all for having me, and thanks for the introduction. So there's a huge problem that is going on in the jail system where the access to care is an issue. I spent almost 10 years incarcerated. I came home, became an attorney, but I never forgot the experience of being in prison. When you have a health issue, you have to fill out a request. A doctor will eventually get to you, but routinely, serious issues are ignored. For example, going to the dentist with just something that requires a filling. Well, they're not gonna fill it, they'll snatch it out. So that too leads to a lot of deaths in jail. Men are being misdiagnosed, they're not properly being taken care of, which brings me to the point of a young lady that I represented in a jail who ended up losing her baby because when doctors told the staff that she would not be able to communicate a contraction, it wasn't taken serious enough. The baby was born in her pant leg, and the baby ended up dying. These claims all fall under the 8th Amendment, and you would think that someone will be held accountable. Well, they're not, because of immunity in the law of immunity. And so when we think about what is happening in our communities, and we think about what is happening in our jails, we're looking at a perpetual cycle. We have men and increasingly women going right back and reintegrating into the communities in which they were incarcerated in. And they are bringing the same problems that they had within the prison back into the community. So we don't deal with post-traumatic stress, we're dealing with persistent traumatic stress.
And so let's move this up from the local level, because so much in my business in journalism, it's almost always a local story.
Yeah.
Some terrible thing that happened in this county or in that jail or in that state. But there are sort of federal implications for a lot of these situations, including the case you're working on, right?
It is. I mean, these cases are prosecuted in federal court with federal claims. And again, the issue of immunity, I think that, and I was just talking with the panelists back in the back, and I think the biggest issue is this. I think that we are being distracted by where the person is to not think about what the person needs. So we always talk about, well, why were they there, right? But that has nothing to do with the care that they are constitutionally supposed to be afforded. And so one of the things that I did when I came home was create a nonprofit called Life After Justice. And what we are doing with this organization is we are training therapists on how to provide therapy for men and women who have been coming through our prison systems. If you think about it right now, with any school, any psychology school, they don't have a chapter dedicated to people who are coming home from incarceration. And so what happens is grandma, auntie, uncle, now they become the therapist to the people who are reintegrating back into society. And it is a wing of the criminal justice system that is continuing to perpetuate the cycles of violence that the mayor spoke about in the city of Baltimore and all across the country. Just as we're here down at Essence Fest, my city of Chicago, where I'm from, there was a mass shooting. The day after that, there was another mass shooting in Philadelphia. So this is all the health concern that needs to be addressed. Our young black and brown men need mental health care badly. They do. And I'm only sitting here because I had 3 black women in my life who refused to not let me get therapy. That was my mother and my 2 aunts.
And Mr. Mayor, how do you deal with that? I mean, the last time I was in Baltimore working at least was in the wake of all of the uprising after the killing of Freddie Gray. These traumas don't go away. What tools do you have, or what tools do you need to be able to address that?
Well, we have to continue to grow the ecosystem, right? When you think about all of that, in our CVIP, in our comprehensive violence prevention plan, it's also about dealing with trauma. It's also about how you approach these folks. It's also about helping people heal in a different way. If folks want to see some of that work, they actually can see it in a documentary about my first 2 years in office called The Body Politic on Amazon Prime. But it talks about every single part of that. We have to build systems that don't exist. When we built this, it didn't exist. The CVIP didn't exist. And you have to invest in the organizations on the ground that can do that work. Because a lot of times what folks want to do is take something that's worked here and just plop it right into another city. Where you lived in Baltimore, you've been there, you know very well. East Baltimore and West Baltimore are like two different cities. I can't take the same thing and drop it on one side of town. It has to be community driven. And our job as leaders really is to invest in the organizations that can do that work and help them grow responsibly. We've been doing that even in our response and ability to divert 911 calls away from police to behavioral health organizations. But you have to do that in a responsible way. An organization can't go from handling 200 of these calls a year to handling 10,000. They're going to go from that to 500 to 1,000. And sometimes the pressure point is folks want it to happen so fast. But if you want to get there fast, that's not the way we want it. We want to get there the right way. And building it in a sustainable fashion is the only way to go, and that's the way we're building.
Yeah, absolutely.
Dr. Mitchell, this came as a shock to me. Again, there's so many of these things that you learn about, and then you think, oh man, there's a big story here, or there's a movement that's needed, or there's a law that needs to be changed. Dozens of police custody deaths that had been ruled accidental or unknown causes by the Office of the Chief Medical Examiner of Maryland have been reclassified as homicides, in part based on what you as a forensic pathologist brought to public attention. Say a little bit about that, and what institutional changes are needed to fix that?
That's really good. I mean, back when the trial of Chauvin was happening, there was a medical examiner that got up and said that George Floyd could have died from carbon monoxide poisoning because his face was near the tailpipe of the vehicle. That vehicle wasn't even running. And so as a forensic pathologist and one of the leading forensic pathologists in the country at that time, I said, absolutely not. So I wrote a letter, over 450 physicians and healthcare providers signed that letter. We sent it to the Attorney General in Maryland, and the Attorney General at that time said, you're right, this is a problem. We asked for an audit into the Maryland Medical Examiner's office. They performed that audit. And then the new Attorney General and the new governor continued that audit, and they just released that report that what you just stated. And so what we know is that our cases of homicides are being classified as accidents and naturals when they're indeed homicides. And that's a function of some of the culture within the medical examiner system, within forensic pathology, that needs to be rooted out. One of the things that we're asking for at the National Medical Association is a checkbox on the U.S. Standard Death Certificate that says death in custody, yes or no. Very simple. Everybody's going to die, and when the person dies, they get a death certificate. But right now in this country, if you were to ask any data source, there is no clear number of how many people are dying in the hands of law enforcement. Yeah. Whether it's at the hands of law enforcement in the street or in jail. We don't know how many people are dying and from what. And so data is the answer to at least understanding it, and then we can lead to prevention. I'll tell a quick story about, just to edify my good brother. There is if anybody's from Atlanta here, you might know the case of LaShawn Thompson. LaShawn Thompson in Fulton County. He was called undetermined by that medical examiner. Ben Crump, Know Your Rights Camp, and Colin Kaepernick gave me a call, said, could you look at it? I looked at the case. It actually was death due to severe neglect. He had thousands of body lice on his body. He was allowed to die on the floor of his jail cell, dehydrated, losing 30 pounds without his schizophrenic medications. He was allowed to become catatonic on his floor and die. We called that a homicide based upon my review. That led into a Department of Justice probe. That Department of Justice probe listed the multitudes of things that were unconstitutional that needed to change in Fulton County. These are the types of things we need to bring this to light, because individuals behind bars are no less than anybody else. And we all, if you know anybody that's incarcerated, you need to clap your hands, because this is the work that we do for them.
Okay. In our last few minutes, I'd like to each of you to give us some homework. Yeah. What should political candidates, what should political parties, what should activists, citizens, journalists do in the coming year? When we meet up again next summer, what should we be working on? We'll start with you.
Thank you. It's a great question. So I want to use an analogy, right? So whenever a fire department dispatches and they're going to put out a blaze, everybody knows exactly what they're doing. You got the guys who are tapping the water hose, the people who are breaking out ladders, people who are feeding the water hose. They're feeding the water hose where? Up to the front, because at the front is where the person is directing the water to put the blaze out. That's what we need to do with the resources in the black community. We have to find the people who are the closest to the blaze, provide them with the water that they need to put these blazes out. It is at this point, it is a critical time right now. Funding is being taken away from those organizations that you talked about, Mayor Scott, that are on the front line. My organization was one of them where they took away funding from us for when we were doing the mental health care program. So you gotta understand that when things like that are being attacked, that is because they know that those things are the solutions. We have to identify the people who are in these communities, like the NCAA identifies the talents who are in high school. We have to do it. It is our job, and that is the solution. When we get back here next year, and hopefully all of us are here, even more of us are here, we should be able to tell a story about how we walked off of this stage, linked arms, and we supported those who were closest to the fires. Thank you.
Okay, just in time, we have a special fourth panelist who's going to join us here on stage. Representative LaMonica McIver is the first black woman to represent New Jersey's 10th district. She's the youngest woman ever elected to the House of Representatives from New Jersey. She's a member of the House Small Business and Homeland Security Committees, but she appears on this criminal justice panel because she was recently arrested, as you may have heard, at an ICE detention facility in Newark. She has been charged with forcibly impeding and interfering with federal officers, and we're going to invite her to join us here on the panel right now. Okay, as you get settled, Representative, we were just, I was just asking the other panelists for some homework, which might, in fact, include the federal government. So let's continue with Dr. Mitchell.
Well, I'm from Jersey, so it's always good to see my congresswoman come in. I'm from Jersey by way of D.C. I think the mayor had got it right. You know, this public health approach to violence prevention is critical. Violence is a symptom of a system. Violence is a symptom of a system. And W.E.B. Du Bois talks about education, economics, housing, healthcare, criminal justice, and if he was around now, he would say environmental justice. Those 6 things, really, access in those 6 areas decreases violence, right? And so I think that if anybody can take that message back, do that. Surrounding death in custody, one of the things in the movement of trying to get the checkbox on the U.S. standard death certificate, we need to have it on the state and local death certificate. That state death certificate has the ability to put death in custody, yes or no, on the local electronic death certificate. So ask for hearings from your local state legislature to ask for that checkbox. Get people to come and talk. I'll come and give testimony surrounding the importance of the public health approach to death in custody so that we know how many people are dying at the hands of law enforcement or in the criminal justice system. That is a very clear way that we can gain power. We can start looking at that data. If you are a researcher, do all your Freedom of Information Act to your local county, the local state, about how many people are dying in custody, and include your ICE detention centers. I gave congressional hearing a report when the 2 babies died not too long ago surrounding infectious disease, and they're dying from natural causes. Understand that natural causes in jails or prisons can be prevented. And so just because they label them natural does not mean that the organization was not culpable in that natural disease process that led to their death. So these are the types of things that we need visibility on. Right now, there's a cloak. The Deaths in Custody Reporting Act is not being held responsible to it. So thank you so much. That's what you can do.
Okay. Real quick.
I think I'll keep it real simple. We need to fight because if we're going to continue what you're seeing in Baltimore and Birmingham and Chicago and Philadelphia and city after city, where myself and my brother and sister mayors are doing something that they said couldn't be done. that we couldn't significantly reduce gun violence by not doing it to lock up everybody the black way. We're doing that. But you can see what the response is. The response is to cut everything that has helped us do that. So we have to organize and fight. At the local level, community organizations have to partner with their local governments, with their state governments to try to fill the gaps when, not if, when the orange folk cut their funding, the federal funding. We have to do that, but we have to keep the work going. We've been able to save lives in cities, black cities around the country, by looking at gun violence as a public health issue with historic investment. We cannot be afraid to keep doing that no matter who doesn't like it and no matter what happens to the leader. And that means doing the right thing even when it's not popular. That means doing the right thing even when it means something might happen to us, like it happened to my sister sitting to my left. That's what true leadership is. You have to be willing to put yourself on the line for your people, especially in a moment like this.
Okay. So, Congresswoman, thank you so much for joining us. Please give us an update on what happened 3 weeks ago, why you were at the ICE detention facility, and what is the current status of that case?
Absolutely. So thank you so much for having me. It's a pleasure to be here with you all. As many of you know, and some may not know, I went to Delaney Hall in my district in New Jersey with two of my rep colleagues in New Jersey, Rep. Bonnie Watson-Coleman and Rep. Rob Menendez, to do our jobs. That's why we were there. We weren't there to protest. We weren't there to do anything other than showing up to do our jobs, to have an oversight, which Congress has a statutory right to inspect any ICE facility without notice. You don't need an appointment. You can show up, have a oversight visit. And we've done this in the past. We did it a couple of weeks prior to this visit, literally at a facility just a couple of miles from there. When we got there, we were automatically met with confrontation. There was a lot of confusion, a lot of, pushback for us being able to get inside of this ICE facility that's ran by Geo Group, which is a private prison company that also has ties to both Holman as well as Nome, which is two members of Donald Trump's administration. They were lobbyists for them, and they've worked for them in the past. They automatically attacked our mayor of our largest city in New Jersey, Mayor Ras Baraka, arrested him for no apparent reason. And that's kind of what sparked off this whole chaos and confrontation that you see, literally, that people are playing on videos all throughout everywhere at this point. Everybody's seeing the video. But at the end of the day, they caused that confusion because they're unhinged, they're cruel, and they don't think that they answer to anyone. So the fact that 3 members were there to do an oversight visit to find out what was going on at this facility, because this facility had been operating without any permits. We did not even know that it was operating as a detention center until the mayor informed us about it and was like, hey, we don't know what's going on here, and they won't let us in for a visit. And so push back a couple of weeks later, after they said they were going to charge me for impeding, assaulting a federal officer because of what they did in the confrontation that they created. Literally, this place had a whole riot. We had the detainees there were not being fed. They had not been fed in days. And when they did give them food, it was cold. And so they literally broke out into a riot. And 4 detainees escaped through a makeshift wall and got out. Now, this is how we could have prevented this if they had proper permits, were adhering to the city's compliance rules, but they don't think they answer to anybody because this administration is cruel, unhinged, and this is the way that they operate each and every day. So far, as mentioned, I've been charged with 3 counts of felony where I can face up to 17 years in prison for simply doing my job by the federal government. And so we're fighting it, obviously. I pleaded not guilty a week ago because I'm not guilty, and it will not waver me or stop me from doing my job. This is why the people of the 10th in New Jersey elected me to do my job, and they will not intimidate or bully me or scare me out of doing that. And that is exactly what Mayor Scott just talked about. We have to continue to be fighting, to be focused against this administration, and we can't allow them to scare us out of being advocates for our communities and doing the work that the people expect for us to do. So I am, I always tell people, don't worry about me. Because at the end of the day, I'm good. They're not going to steal my joy. They're not going to steal my will to work for the people that have elected me. And so that's just the bottom line to that.
Well, Representative, we are going to worry about you. And if I could ask you, look, I say this to some of my colleagues in journalism, that no matter how weak a case is, there's no such thing as a flimsy indictment that has your name on it,
Correct.
right?
Yeah.
So it will take some time. Who pays for the attorney? What is the burden that you have to bear in order to work your way through this? Because that burden, I believe, is in some ways the whole point of the exercise from their side, right?
Exactly. That's the point. Like I said, everything that they do is based in cruelty. So they want to humiliate me. They want to make it as bad as they could possibly do. They want to take this all the way to the point, because there's no slush fund for legal fees. For us, you have to raise money to fight these people, and right now I'm looking at a legal fee. It's very expensive, up to $700,000 to $800,000 to fighting them. We have a very strong legal team. We have a legal team that is very positive and feels very good about this case. But it's still the process of getting there, and they're gonna, stretch this thing out to make it as bad as possible for me as they can. And so that is the point of all of the cruelty. And they feel like if they could get away with doing it to me, they can get away to doing it to anyone. Just imagine if they can treat a United States senator like that, if they can, do that to the New York City comptroller, all of these things in light, to 3 members of Congress, to a mayor. Imagine what they're doing in the dark when people are not looking. So this is what they want to happen. They want to see this happen, so it intimidates other people from speaking out and doing their job.
The bill just passed that you and so many others tried to block. I know that it includes a big increase in funding for detention facilities and for ICE officers. What is that going to mean for our communities?
Well, that money goes into effect immediately. By them giving them this extra funds, a lot of money, actually, over $100 million for them, it makes ICE and Homeland Security the largest federal agency, the biggest budget right now. And so they're going to be even more unhinged. They're going to continue to do things that they're doing. We saw the president walking through, Alligator, Alcatraz, all of this foolishness, but this dangerous foolishness, because this is dangerousness where you see all of the things that they are doing, but they're gonna just ramp up every day and continue to be unhinged and crazy. And ICE officers, they have no rules that they're following. Like our local law enforcement, all of these folks that have rules, that when they do something like they're doing, like beating a gardener in public in front of everybody while folks film that, they are not being held accountable. They are not answering questions. We have been trying to get them to oversight committee, to the judiciary committee, to answer questions about the things that they are doing that we see with our eyes in broad daylight. And literally, they are trying to escape responsibility each and every day. So this is going to make it worse.
And I guess a final question would be, to the extent that members of Congress in the Democratic Party are anticipating that the unpopularity of some of the things that the polls indicate, some of this approach to immigration, is going to result maybe in a change in control in the House, that it's going to be unpopular, that some people are going to lose their jobs for doing some of the things you're describing. What's the agenda if your party does win control of the House? When we meet here next year, as we're coming down the home stretch or whatever it may be, what will be the argument for a different approach, and how can people get more, hooked into that?
Well, I tell my colleagues across the aisle all the time, you're not going to be in power forever. No, that's the honest truth. They will not be in power forever. And I tell them the consequences of them serving their king Trump instead of serving the people that have elected them in their, various districts is going to hurt them. They're going to lose re-election. And so, Leader Jeffries, as well as many of my other Democratic colleagues, we always say they have a Project 2025. We have a Project 2026 where they are going to be unelected. We're going to have new members, and we're going to control the House come next year, because people are fed up. And not just people who are Democrats, Republicans are fed up too. Poverty is not just a black issue or a Democratic issue. It is an issue of white Americans as well, and Republicans. And so many of these things, when you're taking 17 million people off their health care, you're restricting SNAP benefits, these things are going to have effects that are going to trickle down, that are going to hurt people. And some people are going to die from those decisions. And so at the end of the day, they're going to have consequences to them deciding to do this, to serve Donald Trump instead of their constituents. And so we have to stick together. We have to be unified. We have to be together in this fight, and we cannot allow them to just let us roll over, or make us roll over for that matter, and let them do whatever they want to do to us. We have to continue to be in the fight even when it seems hopeless. Even when it seems hopeless, we got to continue to be together and fight through this to make sure that we win control of the House, possibly the Senate, come next year.
Okay. That brings us to the end of our time. I want to thank all of the panelists. Please join me in thanking these panelists. We had a great discussion here, a lot of food for thought, and I want to thank them all, as well as the Global Black Economic Forum. Thank you.